Now DTPA scan. DTPA scan, as we mentioned earlier, the radio tracer agent used in this investigation is technetium labeled diethylene triamine pentaacetic acid, shortly known as DTPA. The indications of DTPA are commonly assessment of the renal perfusion, as we mentioned earlier, to evaluate the differential function of the kidneys in terms of GFR. The spread function of each kidney is evaluated. To look and assess for any obstruction to the drainage of urine, for example, PUJ obstruction or ureteral obstruction. One is labeling the presence and the other is degree of obstruction. In follow-up patient after surgery for renal outflow obstruction like PUJ obstruction, when pyeloplasty is done, the patient are followed with the DTPA scan. After preparing the patient and injection of the radio tracer agent, the images are taken from the posterior aspect of the patient. When we are examining, reading the DTPA scan, we are looking to the patient from the posterior side. So our right is the patient right and our left is the patient left. The other thing is the area from which the radioactivity is measured is called the area of interest. Now the DTPA scan can be absorbed by many other organs of the body as well. So the operator marks the renal areas from which the gamma camera detects that radioactivity. So that is called the area of interest. And there is perfusion panel, excretion or drainage panel, and analysis panel or curves. DTPAs mainly consist of these things. We will discuss it in the coming slides. This is these are the kidney areas marked. We call it as an area of interest. It is right kidney, or right is the patient right, and it is the left kidney. Area of interest for the left kidney and area of interest for the right kidney. So the background activity is subtracted by the operator by computer. So the gamma camera detects these areas. In DTPA scan investigation, this area is called the perfusion panel. These images show the perfusion to the kidneys, and when contrast comes into the collecting system, and it is then called as the drainage or excretory panel. These images are collectively known as the drainage or excretory panel. These are the parts of the DTPA investigation. And the third part, as we mentioned earlier, is the analysis or curves panel. We will discuss it in the detail later on, but this portion of DTPA is called analysis panel or curves panel. Each kidney is represented by different curves. This is curve for one kidney, and this is for right, green, and this is for left. The normal curve for the kidney is like this. This is vascular phase. The kidney takes the contrast. There is a P. After this is a concentration phase or parenchymal phase. In this phase, the radio tracer agent is concentrated in the kidney, and this is excretion phase. The graph should be coming like this now. At 20 minutes, the diuretics are administered, shown here. This is normal. Now these are different graphs shown here. This is the normal curve which is coming like this, type 1. Type 2 is hypotonic curve. It falls promptly with diuretic. It will not coming down normally, but after the administration of diuretic here, the graph will be coming like this. The third one is the obstructed, this red one. This. After diuretic administration, the graph is still not coming down. So this is rising curve. It indicates the obstruction. It is called type 2 curve. And the other one is equivocal. It comes down a bit after the diuretic administration, but again rises. So it is equivocal, non-conclusive. This is another demonstration of the curves. This is normal curve, this blue. This red one is the total obstruction. The graph is not coming down after the diuretic administration. This one is indeterminate or partial obstruction. These one, because the graph is coming down after the administration of the diuretic. Now perfusion graphs, which is indicated by this red area. There are two perfusion graphs. One is aortic perfusion graph and other is the renal perfusion graph. When the blood flow to the kidneys is normal, the aorta and kidney flow curves have a similar steep initial rise. Both will be having a similar shape and similar rise. When the blood flow to the kidney is impaired, the slope of the aorta flow curve remains steep and the renal flow curve remains flat. The curve of the renal blood flow will not follow the aortic curve. While in case of inadequate radiotracer injection, both the curves will remain flat. This is a sample of DTPA scale. It is labeled here with the MR number, age, name of the patient, contact number and address. Now here is mentioned procedure. Sequential images of the posterior abdomen obtained for 30 minutes following the IV injection of technetium labeled DTPA and injection furosemide 40 mg given at 15 minutes post radiotracer agent post-void images are obtained. Now here the split function and the status of the kidneys are mentioned. Cortical phase images show non-homogeneous uptake. About the left kidney, the cortical images show non-homogeneous uptake of the tracer in the kidney with photon deficient pelvic ileal regions, which shows delayed filling. Excretory phase images shows tracer retention in the pelvic ileal system, which does not clear significantly after the diuretic administration. And the delayed post-void images, the split function is 54 ml and 45%. This graph is of left kidney. It should be normally coming like this. But as mentioned in the description, the graph is not coming after even the administration of the diuretic. And so it shows the obstruction of the left kidney. The right kidney cortical phase images show non-homogeneous uptake of the tracer in the kidney with photon deficient pelvic ileal system, which shows delayed filling. Excretory phase images show tracer retention in the pelvic ileal system, which clears partially after the diuretic administration, and the delayed post-void images. This is the right kidney. The curve is going up, and after the administration of the diuretic here, it is slightly coming down, but not normally. So it is a partial outflow obstruction. Here it is the renal areas left and right area of interest. This one. This is another scale. A patient with left side gross hydronephrosis and history of renal stones. The left kidney cortical phase images show reduced and non-homogeneous uptake of the tracer and dilated pelvic ileal system. This red graph is of left kidney. It is also showing that the graph is not coming down, and even after diuretic administration, it is remaining flat or high. So it is also left renal outflow obstruction. And the right kidney graph is almost normal. It is coming down here. This is the area of the right kidney and this is left. Now another scale, the right kidney shows delayed perfusion of the tracer and poor and non-uniform cortical tracer uptake. Comments cannot be made on the tracer clearance due to the reduced cortical tracer uptake. It was a case of right poor functioning kidney. Here we can see that the right kidney is not visualized, this one, and it is the left kidney. The graph of the left kidney is this one, going up and coming down. This graph of the right, it is almost flat. As we mentioned earlier, that if the perfusion